not an uncommon diagnosis in the horses that I'm treating. So where in the body is affected? I pinched this picture, so the blue spots don't really mean very much, but my sort of labels and arrows are kind of the joints where we most commonly see osteoarthritis. So I would say in horses that I treat, probably the more common sites for arthritis are sort of the coffin joint, which is in sort of old horsey speak. It's known as low ring bone. The pastern joint, I see quite commonly osteoarthritis, and that's also known as high ring bone. The hocks can be affected too, pretty commonly, which is known as bone spavin, and then the stifles too. We do see osteoarthritis in knees too, but not quite so common in the sort of the types of horses that I see and treat regularly. And we do also see osteoarthritis in the neck and the joints between these neck vertebrae, and they're known as the facet joints. But you know, they're less common. So why does osteoarthritis happen? The causes aren't really fully understood, and despite sort of lots and lots of research, we don't really know. So the kind of proposed sort of thoughts as to why, you know, osteoarthritis does form in a joint is primarily that it's a disease of wear and tear, and that's sort of, you know, thinking on the basis that we see it in animals that are older. But we do see osteoarthritis in younger horses too, and we sort of think of this as a juvenile arthritis, which can be more tricky to treat sometimes. So for that reason, we think that it can't just be a disease of wear and tear. There probably is a genetic predisposition, which increases risk of developing this OA joint disease. Certainly acute or traumatic injury directly to the joint itself. So that might be a wound over a joint, which causes a different type of arthritis actually, a sort of a septic arthritis, but that in turn can increase the risk of that joint developing osteoarthritis in the future. But also just a real, you know, a blunt blow or a knock to the joint or a twist or a turn or something like that, that certainly can flare up osteoarthritis in joints. Weight is definitely a contributing factor. So horses that are carrying a little bit extra than they should be, and maybe at the kind of the higher end of those body condition scores that we think about, that can definitely increase their risk of developing osteoarthritis. Conformation contributes too, and you know, I think there also are these horses that are just born that way. They've just been born with rubbish joints, unfortunately, and you know, certainly the hocks and the knees can be affected just because the joints didn't form correctly. But you know, we do unfortunately see some horses that, you know, where the cartilage is affected in multiple joints, and we do wonder actually, you know, is this any of those above factors, or you know, did the cartilage just not form the way it should have done when that horse was a foal? So what do owners see? Why does an owner ask us vets to see their horses, when we might be thinking about arthritis? I think most commonly it's a lameness that raises a cause for concern. And they can be sort of mild to moderate, but actually they can be, you know, at the severe end of the spectrum too. It's really quite variable. Performance issues are another reason that we would be asked to see a horse, and we may end up sort of subsequently finding out that they're struggling with joint disease and arthritis. And that could be all sorts of things. You know, it could be that they're not making heights in show jumping as they were before, they're not making time cross country, a general reluctance to work or not moving forward. Sort of quite a classic sort of story with a horse with arthritis or with us with arthritis too is that, you know, we're stiff and sore when cold, and I don't just mean cold temperature wise, but you know, just fresh out the stable, and actually that can improve with gentle exercise. So certainly an owner that tells me that their horse is lame coming out the stable, and you know, they walk it off for sort of 5 minutes and then they look almost sound, that would be raising my sort of index of suspicion for osteoarthritis. somewhere on that limb. Sometimes owners will be concerned because they've spotted swellings of joints, and certainly we do get joint swelling consistent with osteoarthritis. And actually sometimes, lots of horses, particularly older horses that are retired, we don't notice those more subtle lamenesses, and certainly aren't spotting the subtle performance issues and that sort of thing. And actually the reason we might find that a horse has got generally stiff, sore, arthritic joints is because the horse is having a problem getting up and down. So, it's not a common reason that I'll be chatting to an owner, but certainly this sort of sleep deprivation type symptoms where owners are seeing horses that, they're stood tied in the yard being groomed nice and relaxed and they just fall asleep, and sometimes, end up hitting the deck falling asleep. That often is because that horse has got some sort of joint pain and they're just struggling getting up and down. And that's sort of something that, often owners will be worried that the horse is narcoleptic. And actually we find that when we go and look at that horse and investigate a little bit further, 9 times out of 10, we find that there is, a sort of an orthopedic pain component, and they're just not laying down and having that proper deep sleep. So how do we reach a diagnosis? History, so that's the story. That's us getting out of the car and having a chat with you outside the stable, and sort of hearing when you saw it, what you saw, when it's worse, when's it better, and like I say, that often there is that sort of typical stereotypical story anyway of the fact that the horse is worse cold out the stable. And then it's sort of on to our veterinary exam. So observing the horse's stance, seeing, how they're positioning their limbs. Are they choosing to rest a particular limb? I mean, these are kind of all sort of typical things that we're thinking about in a general sort of lameness sort of assessment, but definitely in this context. Looking for swellings, joints that are puffy or effused, that might make us sort of concerned about a particular area of the limb that we want to look for in a bit more detail. And once we've sort of done that visual kind of distant look at the whole horse and the legs, we'll then get our hands on and have a really good squeeze and a feel, and sort of that forms the palpation part of our assessment. And certainly in the context of arthritis, we're particularly interested in the range of motion of the joint, and how freely that joint is sort of flexing sort of in the direction it should. And we'll often sort of try to, move those joints and kind of manipulate them as sort of individually as possible. We'll be looking for sort of pain on palpation of the joint, or pain when we sort of flex it. That could be indicative of joint disease and often osteoarthritis. And again, looking for swellings and heat and that sort of thing. Flexion tests, we don't always do these, and some vets will say they're rubbish and actually don't really add that much to the picture, but then other vets will say that they are a useful piece of the puzzle. Certainly flexion tests that are positive, so i.e. we flex the limb up and then the handler trots the horse away and the lameness is made worse by flexion, that would make us suspicious of the joint being sore for some reason. It's not specific to the joint, but it would certainly raise our sort of our suspicion, I suppose. We might need to sort of, based on what we found so far, we might need to then move on to some nerve blocks. And again, this sort of fits with how we'd approach any lame horse, really. We obviously, some horses, we're not going to be doing all of these things, but this is kind of the most comprehensive sort of way that we would reach an arthritis diagnosis. And those nerve blocks are desensitizing specific areas of the limb with local anesthetic, sort of normally in quite a sort of a systematic approach. And we're trying to localize the region of pain so that we've got a region of interest somewhere on the leg, and then we can then look into that area in a bit more detail. So if the lameness is improved after a nerve block, so after we've desensitized that area, that means that we're concerned that area is probably contributing to the to the pain or to the lameness. And then we've got sort of various ways that we can image the leg, so we can, you know, take pictures, and diagnostic imaging are kind of all the different ways that we choose as vets to have a look at the internal structures of the horse's leg. But in the context of joint disease and arthritis, we're probably most interested in X-ray in the first instance, which we can usually do that on the yard. And although that doesn't show us any detail of the cartilage itself, which I said earlier, that this arthritis disease is primarily a disease of cartilage, it does give us information on what the bones look like either side of the cartilage in the joint. That really helps us in understanding what's going on. We might sometimes use ultrasound too, to help us in our diagnosis for arthritis. And depending on which area of the limb we're worried about, there might be sort of other sort of more advanced imaging types that we recommend, and they would usually involve a trip to hospital. So MRI can be helpful for diagnosis of arthritis in feet, for instance. If we're not spotting things on X-ray, MRI gives us some really useful additional information about the bone, and actually sort of the degree of inflammation in the bone that we don't spot on X-ray, and gives us a lot more information generally. And then there's some other sort of imaging types that we sometimes think about. So CT, which is 3D X-rays, basically. Sometimes we might be reaching for those to help us. CT is particularly useful if we are concerned about osteoarthritis in the neck, so in those facet joints in the neck, which is a sort of not an uncommon cause of poor performance in horses, and we'd be going for CT for those, and then there's sort of other things that we use very occasionally, like bone scan as well. So I said that generally we're looking at X-rays to diagnose arthritis. So I have got two pictures here. So on the right we've got a normal hock, and on the left, we've got a hock with pretty advanced joint disease with arthritis. So we'll look at the normal one first. So this is above the horse's hock. So this is the tibia coming down here. The point of the hock would be sort of on the back here. So that big bone is what forms the point of the hock. And there's lots of joints that make up the hock joint overall. And all of them actually can develop osteoarthritis, but most commonly it's these bottom two joints here that develop arthritis. So the white is the bones that we're interested in, and then the black in between, they're the joint spaces. So they're those spaces that I said have got some cartilage in there, either side of the bone, and there's also joint fluid floating around in there, lubricating that joint. So this one on this side is a nice healthy joint. Okay, so we look at lots of different things to diagnose arthritis on X-rays, but this is a nice example of what can happen to the joint space. So looking at this X-ray on the left, you can see that there's a loss of this nice black line. So where there's a nice black line here, nice smooth edge of the joint, we haven't got that. There's all this sort of fuzzy stuff. And that's because the body has responded to the cartilage damage by laying down new bits of bone. And it's the body's way of trying to strengthen the joint because it knows that it's losing the cartilage. But actually laying down this new bone, and although the body thinks it's making the joint stronger, it actually is a really painful process. So this is one of the sort of arthritis disease processes that we seek to sort of modify in our treatments, because that can be really painful for the horse. So looking at this fuzziness, the loss of that nice black line, the joint space, and then there's also the fact that there's all these knobbly bits on the front. So these we call them bone spurs. On the front of the joint there, which we've just got a nice smooth line here. So that's sort of, this is quite a nasty grisly hock, a sort of a more advanced arthritis case. But these are kind of the two ends of the spectrum. And there are other things that we look at on these X-rays as vets, but they're kind of the nice ones that are easy to spot and to be aware of. So how do we treat osteoarthritis? So probably the million-dollar question. We haven't got a magic treatment, unfortunately, that is curative, so actually cures the disease. Our aim of treating osteoarthritis is to manage the symptoms and to try and delay the disease progression. And what we're usually going for there is we're trying to manage the pain and the inflammation within the joint and reduce the levels of both of those to hopefully zero. And what we're also usually trying to do as well is try to delay that breakdown of cartilage and therefore the kind of progression of all that new bone being formed. So we've kind of, got lots of different things. So there's a few pictures on the screen there. So usually at some point, I think most horse owners will have come into contact with non-steroidal drugs. So long posh name for just painkillers, basically. So for us humans, that's your ibuprofen, your Nurofen, they're NSAIDs. And you know, the horse ones that we're thinking about that we use in horses in the UK at least, you know, the main ones are sort of bute, Danilon, meloxicam is another one, and you know, most of those are sort of powders, granules, liquids. There's various different flavors and things like that, but essentially they all do the same thing. They're all acting on the horse's body as a whole to reduce inflammation and to combat pain. They're not acting specifically on the area of the disease, on the joint. You know, we can inject these. Sometimes we inject sort of these types of drugs into the muscle or into the vein, but the majority of the time we're probably using them as these oral types, these powders, these granules, the syrups, the pastes, you know, whatever it is that we can convince our horses to eat. So then we've got things that we use a little bit more targeted, so are maybe used for you know, specifically in an area that has a problem. So steroids or cortisone injections are next on the list, and these are usually injected directly into the area of concern. So they're injected directly into the joint, and they are acting locally to reduce the inflammation and the pain in that joint. So they're really helpful from that point of view, but again, remember that they don't actually act to cure the arthritis disease, they're just managing the symptoms. Then we've got sort of other things that we can inject into the joint too. So Acrylamide is one that we use fairly frequently in the horses that we see as a practice. So that's a polyacrylamide gel. And some of you ladies listening may have come into contact with that before, because that's the stuff that goes into your fillers, your lip fillers, that kind of stuff. It's exactly the same chemical. And it was originally developed for cosmetic therapy in people, and then we sort of saw that it was having various beneficial effects to soft tissues, and started looking at it in arthritis models, and we've been using it in horses for kind of the last 5 years or so. And what that does is it binds to the inner surface of the joint capsule, and it acts as a shock absorber. So it's trying to replace the job of cartilage whilst that cartilage is being damaged as part of this disease process. Like I say, we normally inject this directly into the joint, into the problem area, and we often will be injecting that alongside another drug. So, you know, most of the time we'll be injecting that with a powerful anti-inflammatory, so a steroid as well. And then Tildren is next up. So Tildren, or there's another product on the market as well in the UK known as Osphos. And what these are, they're sort of their posh name, their class of drug. They're a bisphosphonate. And what these type of drugs do is they act to alter the bone cell metabolism. So in osteoarthritis, the body is responding to those increased forces through the joint by laying down new bone and replacing the bone cells constantly. And like I said earlier, that in itself is quite a painful process. Now, what these bisphosphonate, these powerful drugs what they do is they actually work on that bone metabolism, and they aim to slow down the rate of turnover of bone cells. And, you know, for that reason, actually, they're pretty effective. And, you know, I really like these sorts of drugs, and I think they can be really beneficial in horses with osteoarthritis in reducing inflammation, and actually as sort of really potent bone painkillers. And you know, there's a couple of different ones, but generally these are acting on the horse's whole body. They're not being injected directly into the joint. So the benefit with these as well that I like is that if you've got a few niggly spots, you know, you might have some sort of nasty hock arthritis that you're actually keen to treat, and you're reaching for something like Tildren, but actually because it's gone in and it's treating the horse's whole body and it hangs around in their system for quite a long time, actually you're treating other areas too. And some of you listening might have come into, you may have had horses that have been treated with Tildren or Osphos for sort of navicular disease as well, because that's a disease that has or can have a similar sort of disease progression and process to arthritis with this bone turnover, which is why it can be particularly useful there. Surgery, I mentioned, in the context of sort of straightforward arthritis, we probably don't go for a surgical option that frequently. You know, we're certainly not doing sort of joint replacements in horses, you know, like we might be in us with nasty sort of arthritic joints, or you know, like our small animal colleagues do in dogs. But we do sometimes reach for a surgical option with horses struggling with sore joints and osteoarthritis. And usually if we're doing that, what we're going for there is we're going into the joint with a camera. It's usually a keyhole surgery. And we're going in there to scrape out bits of diseased cartilage. Those diseased bits of cartilage hanging around and flapping around in the joint can actually sort of propagate the inflammation and cause the inflammation in the joint to continue. So going in and removing them can be helpful in settling inflammation and pain down. And sometimes actually also the surgeons will be doing sort of various other clever things like fusing joints, sort of in sort of real severe arthritis cases, but this isn't something that we're regularly reaching for. So stem cells, there's a product called Articell, which is a stem cell product licensed in the UK, which is specifically for cartilage disease and osteoarthritis. It's been around for sort of about a year now, and we have used it as a practice. And you know, certainly the initial research is pretty positive and good. You know, it's a new innovative product that is acting to settle the inflammation within the joint and actually dampening the inflammation itself. But actually the stem cells that are going in there, they're chondrocyte stem cells, so they're specifically aimed to be they're cartilage type stem cells. So although, you know, I'm not convinced that they can, you know, fully repair cartilage that is damaged and essentially repair the areas of damage, what the sort of the various research that the manufacturer has sort of shown is that they can act as a sort of a plaster and form a plug in the damaged cartilage surface, and kind of, you know, replace what was there in a way, which you know is really positive. And again, those are injected directly into the joint. And then there's sort of some other things that we think about too. So Osteopen, Cartrophen, they're the same thing. Their active sort of drug that's in there that we're interested in is the Pentazan. Lots of you with dogs, stiff older dogs, will probably have come and sort of met Cartrophen. It's, you know, it's a really great drug that acts to settle joint inflammation. And again, we're giving this as a sort of as a general whole body approach. So these are injections given into the muscle, sort of varying different kind of protocols and regimes and frequencies of treatment depending on what sort of disease we're treating. But because we're giving them to the horse's whole body, you get the benefit of sort of the drug working in each and every one of the joints. And as well as reducing the joint inflammation, there's some research that's also shown that Cartrophen and Osteopen, this type of drug, can increase the chondroitin levels in the joint, and that's a key component of cartilage. Now, by increasing chondroitin levels in the joint, I'm not saying that that's going to be magic, and that's because this key ingredient of cartilage is there. It means that the cartilage can suddenly regenerate, because unfortunately it can't. But chondroitin is needed for lots of sort of the healthy processes in the joint, and lubricating the joint, and forming part of that joint fluid. So that's all good stuff. So good farriery. I can't sort of overemphasize how important it is that you've got your farrier on side and on board in particularly in a horse that's struggling with sore or stiff joints. And generally we're sort of aiming to optimize their foot balance, and get the angles as sort of close to perfect as we can. And by doing that, we're reducing the stresses and strains on the limb sort of further up, above the foot. But we might do some specific things with farriery if we've got arthritis within the foot or certain areas on the leg. Then we might recommend sort of specialist remedial type shoes, or particular ways of trimming the foot, and we'll work with your farrier on that. But definitely remedial farriery in those severe cases, it can really help with managing pain in these stiff sore joints. And then there's sort of physiotherapy and other sort of complementary therapies. Again, a really beneficial sort of thing to be thinking about in terms of treatment for osteoarthritis. And generally these sorts of therapies are sort of thinking about aiming to optimize core strength and stability and flexibility, but they'll often be working on sort of individual joint or sort of limb mobility, and working on getting those joints doing what they should be doing, despite the fact that there's arthritis there. So definitely any horse that's suffering with that sort of stiff sore osteoarthritis type joints, I think physio and some of those other sort of complementary therapies can definitely be of huge benefit. So what about supplements? I'd say that this is probably one of the most common questions I'm asked by clients in the context of osteoarthritis. As you all know, there are thousands of equine joint supplements on the market. Now, I promise I'm not biased. I know that Odavad are supporting the series of talks, and they are a company that make equine supplements. But I am, really, really confident in their range, and we definitely feel as a practice that they're the best that we've dealt with. What I will say before we get on to any of the kind of specific products is that my feeling with joint supplements is that you really get what you pay for, and as much as you might not want to be shedding out for the things that are at the kind of higher end of the market, but I think the benefits of that far outweigh the false economy of going for the cheaper ones. I think if you're going for the cheap joint supplement that's like 15-20 quid or less for a month's treatment, you're just throwing your money down the drain. There's just really no point. So like I say, we recommend the Odavad range. There's lots of reasons why we recommend it, but I'm not here to give you a sales pitch. We can pick up individually if there's kind of a reason, if you want to chat with me or Steve or one of the other vets about why we recommend a certain product. But if you've got any specific questions about the Adwell range, Sana's here with us this evening, so she'll be able to help with some of those a bit later on. But I just wanted to list some of the key ingredients on the slide there that are worth considering and worth thinking about what's in your joint supplement. So, I think lots of those you'll probably have come across as horse owners researching this sort of thing. Glucosamine, MSM, chondroitin, those sorts of things, they're in most joint supplements. I know turmeric is something that has sort of horse owners certainly in the last few years have been quite excited about, because there's been some promising research in people about the anti-inflammatory benefits. The kind of the active ingredient that you're looking for from the turmeric is this curcumin, and looking at the kind of the level and the concentration in products is really important. Just what I would just say about that is feeding a few spoons of turmeric powder or whatever, you are not getting anywhere near the therapeutic doses that a horse needs for to have those anti-inflammatory benefits. So as much as it might maybe smell nice and maybe the horses like it, I think it's probably not adding that much. So I think you probably do better to be looking for a sort of a good quality joint supplement that has that key ingredient in. Horses that are sort of a stiff and they've got joints that are a bit stiff and sore all over, we often talk about using devil's claw, and a supplement that includes devil's claw. And the active ingredient that so devil's claw is a herb, and it'll often be listed on supplement tubs and bottles, the Latin name, which is Harpophygatum, but actually the active ingredient that you're interested in terms of concentration in the tub is this Harpoglycide D. And what this actually acts to do, it works on the horse's inflammatory system the same way as an anti-inflammatory drug does, so the same way that bute does, and for that reason it can be a really helpful anti-inflammatory and painkiller for those horses that are a bit stiff and sore, getting older, and just need a bit of support, but maybe aren't quite at the stage where they need to be on bute regularly. I think what I would just say as a word of caution is that, definitely supplements are never going to be better than drugs, medicines. So, if the horse is having a sort of a devil's claw type supplement and they're still struggling, I would be chatting with your vet about that and, whether they need something stronger. I mentioned the white willow here as well, because that's something that I've definitely seen benefits from in horses that I've treated, and that's a precursor of aspirin. So again, it's a herbal sort of key ingredient, but if it's in a supplement, essentially the horse's body will turn it into aspirin. So again, acting as an anti-inflammatory and a painkiller. And then there's sort of green lip mussel extract and omega fatty acids too, which have also sort of been shown as to help with overall joint health and support and anti-inflammatories. And the pictures there are kind of Odegaard's joint range, or at least some of it. And kind of the Echiflex Ultra on the left there, that's kind of a general purpose supplement with lots of those key ingredients in, but it doesn't have any of it doesn't have the devil's claw or the white willow, so the kind of the painkiller sort of ingredients. But it's a really good sort of high quality joint supplement in my opinion. Harpogel is one for those horses that are maybe a bit stiffer and sore, and maybe do need a bit of anti-inflammatory or painkiller benefit, and that's got some of those sort of supportive ingredients, but then also this the Devil's Claw product at a very high concentration. And then Equiflox Nodalox, it's got those supportive ingredients, but then it's got the aspirin precursor, which is helpful as an anti-inflammatory painkiller. But and then I suppose the main things between Harpagil and Equiflox Nodalox is kind of thinking about your horse's job, and when you're considering supplements, you want to be thinking, if I've got a horse that's competing, what sort of level is it doing? Do I need to be worried about sort of anti-doping rules and all that sort of thing? Because if that's the case, then you won't be able to go for something with Devil's Claw in, because that sort of does have those anti-inflammatory benefits. And then additional therapies to think about, I kind of touched on earlier. Physio, we've sort of talked about, obviously. I think, acupuncture is also worth thinking about. It's a really useful adjunct, especially for chronic pain. In the UK, acupuncture can only be provided by a vet, and it is a service that we can offer. So that is worth bearing in mind, particularly in those sort of more chronic, long-standing, maybe pain type conditions. Water treadmill, I know these are sort of growing in popularity, and we've got a couple of clients with water treadmills on their yards. I think there's benefits of water treadmill work for lots of horses, but especially those with mobility issues. And there's research that's shown that water treadmill exercise not only improves their kind of core strength and way of going and symmetry and muscle tone and flexibility and elasticity, but actually in the context of arthritis has also shown that it can improve range of motion in joints, which is of particular benefit in stiff, sore joints. Weight loss, I mentioned. I know I said that earlier, but if horses are carrying more than they should be, and they're struggling with sore or stiff joints, getting their weight down to kind of optimum is really, really important to reducing those stresses and strains on the joint. And that's something that we as vets can always help with guidance. If you're struggling with weight loss and you're pulling your hair out because you feel like you're doing everything right and you're just not getting anywhere, then do speak to your vet about that. We're always happy to discuss that. And farriery, we've kind of talked about already, but again, it's just mainly we're aiming to get those forces as good as we can by getting the angles correct. So that's me in terms of kind of slides, and that's us done for the talk. So it looks like there's been some questions coming through, so I think Caroline is going to kind of hit me with some of those. But just those of you that are here today, just a couple of things. The first thing is that this week is Strangles Awareness Week, so have a look on our social media about that, and kind of things that you can get involved as horse owners and yard managers. So it's something it's being run by Red Wings horse charity, but in association with sort of BEF, BHS, and sort of lots of other kind of key players. But go online, have a look, and make your pledge to try and help us combat strangles in the UK. And then the other thing is just that we're hoping to kind of keep these talks up for a little while. Certainly whilst we're all stuck at home on lockdown, we'll be keeping them going. So next week we've got a talk on Wednesday at 8 o'clock, so a bit later, on the prevention and treatment of obesity and laminitis. And that's with a guest speaker, so David Rendell. He's a vet, an equine vet, and he's an internal medicine specialist with a sort of a keen research interest in laminitis and kind of all the sort of hormonal diseases around it. So he'll be speaking to us at 8 o'clock next Wednesday. So if you do want to get involved in that, then if you drop me an email, and we'll get you a joining link. Awesome. Thank you.
Well, thank you very much, Ryan, for that. That was really great. So we've had a lot of questions. I started writing them down and then I couldn't keep up. So I'm going to read them from the list in front of me from the chat box. So if I start with the first question at the top there. Okay, so, right, people say that keeping a horse out 24/7 can help with arthritis. Is this true? And will a horse that's kept in more necessarily suffer more?
Sorry, I was trying to read it as well, so I wasn't.
Don't worry.
Say it again.
So, people say that keeping a horse out 24/7 can help with arthritis.
Yeah.
Is this